everyone. Welcome back to another podcast sponsored by National Council on Interpreting in Healthcare and put out by the Standards and Training Committee, which I chair. I'm Eliana Lobo, and I'm really psyched to have a very special guest with us today. Someone who actually can lend some tooth to the toothless mandate we have all been fighting to uphold, which is Title VI. And the name of this very special guest is Michael Mulé, who is Deputy Director of the Office for Civil Rights, also known as OCR, in the Office of Justice Programs at the U.S. Department of Justice. Woohoo! OCR ensures that recipients of federal financial assistance comply with federal non-discrimination laws, including Title VI of the Civil Rights Act of 1964 and the Safe Streets Act of 1968. Before joining the Office for Civil Rights, Mr. Mulé was a senior attorney in the Civil Rights Division at the DOJ for 13 years and led the Title VI State Courts Language Access Team. Mr. Mulé is recognized as a national expert on language access. He has presented over 75 civil rights trainings for federal and state agencies, attorneys, and judges, and has resolved many Title VI and language access matters at the DOJ. Really, really excited to have you here with us today because one of the big pushes that NCIHC is doing this year is some education to our members on grassroots activism. How do I find out what is in place where I live? How do I make changes where I live? How do I make a complaint to the Office of Civil Rights? I get asked that at every conference I go to. So welcome, welcome. Let's share some good news with everyone as well as some harsh realities, I guess.
Well, thanks for having me, Eliana. It's a pleasure to be here. And I know the work of your group for decades. I've watched them since they've developed the first standards for interpreters, and I think really cutting edge, really important work for other fields, not just in the healthcare field. So thanks for having me today.
Well, we're psyched. So let's just jump right in.
Sure.
You've been doing this for a while, and I'm sure you've had your fingers in many different pies, but looking back, what got you started? What really gave you the impetus, or what was that
Yeah.
moment that you said, no, this is what I want to do?
Um, like a lot of things in life, I mean, some things just come at you. And one of those things was during law school. Um, not You don't have to do this, which is surprising to a lot of people, but in law school, you don't actually have to take any kind of practical program where you actually interact with potential clients or real clients, which is surprising. A doctor does actually, has to do residency, but an attorney doesn't. But in my law school, we had a clinical program that you could choose. And I was really fortunate that they had one the second year, and it was civil rights and disabilities. And one of my first clients, and this is where it comes down to, one of my first clients was a Spanish speaking woman. She had limited English skills, but her son was autistic and he was nonverbal.
Mm,
And she was facing a lot of different challenging systems. His school, the medical professionals she was working with for him, any number of state and local agencies that they needed to access services for him, for her family, to get him the treatment and services that he needed, the educational supports he needed. And really from that experience with that client, and luckily I had an exceptional paralegal in the clinic. She was just fantastic, and her Spanish was far better than mine. But we worked with that client, and we realized that while we're helping her with this one issue, these are barriers that she's encountering in all parts of her life. Not just this one moment with her son, just not these services with her son. And it really stuck with me. Um, that experience working with her, realizing that these systems, though she's totally eligible, her son is eligible for all the programs. They meet every requirement for the program, but the application form's not available, right? Couldn't, like, if you couldn't understand how to fill out the application form or get into the program, how do you do that? It's not about her eligibility. She was totally eligible. Her son was eligible. And so it got me thinking. And in my third year, I was really fortunate to come across a fellowship, which actually was related to an office I was working in, and it was a 2-year fellowship for after law school. And the thing with the fellowship was you had to pitch your project. And I said, well, of all the things I've learned, and you learn a lot of things in a lot of legal books, but the thing that really stuck with me was that real human experience, that she had, and those barriers that she really had, and her and her family had. And I said, what if I pitched and I didn't call it language access then because I didn't know what that phrase meant in my 3rd year of law school. But what if I pitched a Spanish legal assistance program to help people because I just picked Spanish because that was the largest community in the fellowship had to take place in Rochester, New York, and there was a significant Spanish, Latino community there. So I pitched it, and again, it's not guaranteed, right? It's just an application. You submit it and you compete against a bunch of people, and I was fortunate enough to get it. So luckily, my first legal job was actually one I got to kind of develop and create on my own, and it was this Spanish legal program. And it was just incredible because had I not had that experience in that clinical program, I wouldn't have thought about this could be an area. It is a civil rights area, but it can actually be an area where I first start my legal career, and that was really significant. And I always remember that. Like, that's the reason why, this is something that real people encounter all the time, families, individuals. And, it's just a little piece I could have done in that fellowship over those 2 years, but um, it turned into a job. When the fellowship ended, they kept me on for 3 more years, and I worked on language access issues throughout the state with state agencies, with a lot of really incredible advocates and community groups, and interpreters and translators in New York and nationally. So that was really the start of it. I don't like that she had to go through all those struggles, that she had to experience all that. We couldn't address every single thing that she was encountering, but for her experience, though, I wouldn't have realized how this is a larger issue for more than just, Spanish speakers, more than just that one individual, and that these are barriers that are sometimes systematic, that require real change in a lot of different systems.
And so impactful what you said, because except for the one word of sometimes problematic there at the end, it's always problematic. I see the similarities of what your client faced in being able to access systems that she qualified for, that she deserved to have access to, as very parallel to that limited English patient proficient in other languages but not English finds when they try to interact with our healthcare system. There are so many barriers to accessing healthcare, and they may have a job and they may have insurance, or they may be here under a special visa, which gives them access to health care. But yet, even at a hospital like here in my region of the Pacific Northwest, Harborview Medical Center, which has a huge staff of nearly 50 staff interpreters and many contracts with language service providers to fill in the gaps for all the other 150 languages that the department doesn't fill on its own, it still presents barriers when that patient tries to call the hospital, for example. That phone tree is all in English. It's so hard to get somebody to connect on the phone to help direct them to the number, even to call interpreter services, which seems crazy. And yes, many modifications have been made to that system, but that's one place where healthcare systems fail, even when they have healthcare interpreters as staff, or when they contract for language access services, patients can't call the clinic. They can't get directions. They don't know how to access transportation, or so many things that are related but not directly part of the medical world, but keeps them from being compliant. And they end up getting identified as regular no-shows, or non-compliant with their medication because they may not have understood how to take it, or may have been very expensive for them, so they slowed down the rate of which they take it, or many things and get identified as a quote unquote bad patient, as opposed to someone who just didn't receive the information they needed to be able to be a compliant patient. It's very frustrating to see how many things are built in, are baked into the pie, so to speak, that these people have a real tough time getting around. And that's why we're here. We're trying to make these situations clearer to the folks that administer these programs, right? The folks in the trenches speak other languages and understand other cultures. But the C-suite folks, often whoever is in charge of language access or community outreach or patient complaints, they tend to all fall together, may not have as much experience working, living outside of their own language and culture, never mind with people who come from another language group or another culture. So, yes, that's the battle. But I am really tired of hearing what is Title VI after all these
Oh,
years.
well, one thing before I get to the Title VI thing, and I think this is related to some of what you said, which is, and over the years, I'll say this too, I've seen this more and more, especially with the entities I work with, which are not necessarily, healthcare providers. They're mostly courts, cops, and corrections, that receive funding from DOJ. And I'll get to the Title VI piece, but I think it's really important to also challenge these entities and challenge ourselves in our own programs to say, when's the last time we actually had someone who's going to use this service give us a walkthrough, do user testing of this if they were to call, to actually kind of let's pretend we're this person trying to access this system in all of its facets, right? Let's do a walkthrough. Let's do a user testing walkthrough. Like, otherwise, we're just assuming we know what's needed. Let's actually have someone walk through and help us identify those points where communication breaks down and where systems don't work the way they should. Because absent that, I think it's sometimes hard. And it's not because people have ill will necessarily. I think it's just sometimes hard to anticipate those unless you have to put the time in to actually have real users that are from those language communities walk through those programs that you think are so great, because you might find holes. So I just want to point that out. And I think user testing is one of those pieces where um,
It's
we
critical.
the system's put in place and then we're done, instead of, wait, when we're building this system, shouldn't we have input from the people? And I think sometimes that gets kind of lost. I'll get to the Title
I've been
VI piece though.
advocating to be at the table earlier rather than as an afterthought. Language access can't be an afterthought if you're going to mount a process that works well for the user, not just ticks the boxes on the sheet for risk management or legal compliance or whatever, but does it work for the user? So we're on the
Well,
same.
because here's the thing. What if the system they're going to put in place is actually really resource intensive and more costly than the option that would have been more effective for that language community? It's not always that it's the better choice. It actually might be a cheaper choice that's more, so I think you might lose that moment too. It's not necessarily that because you spent a lot of resources and time and money that it's a better product. It's that you didn't check to see what would be the most effective product when you were thinking of options, and
It used
so
to be that the Joint Commission that accredits hospitals used to hire an actor to play a limited English proficient patient to access the hospital, or two actors, I think, from 2 points, from emergency services and then from an outpatient clinic setting, and track them and see who they were paired with and how language access services were offered. And then if they were paired with an interpreter, they would come and check to see, let's look at that employee's file. Are they certified? Do they do continuing education? Which I thought was great. It really sort of grabbed the C-suite by the collar, so to speak, and gave him a shake and said, this is important. And all your ducks need to be in a row. You can't just hire people that are bilingual, that are untested. They have to be certified. And to stay certified, you need to pursue continuing education. So one thing feeds the other. So that's something about what's happening now that I feel is a step in the right direction. what's happening now in your world that you'd like to talk about and share with us?
Sure.
Can we
I
help
mean,
you move the needle?
well, I'll tell you, just observing, like, I've seen a lot of things that have happened, especially, even just in the last year, the last 18 months, at the federal level and at the state level. At the federal level, I think a lot of push happens, and to distinguish here, federal level, I mean, what have federal agencies been told they need to do in their own programs or activities? And on the federal level, that really starts with something that the Attorney General put out, which is a memo to all the agencies in November 2022. And it said, hey, you all have to comply with Executive Order 13166 because federal agencies are not covered by Title VI. Executive Order 13166 says you're a federal agency in your federally conducted programs or activities. You need to provide meaningful access to persons who are LEP. So that memo said, look at your current language access plan, federal agencies, and see are revisions, are improvements needed, which has been said in the past. But I think one thing I wanted to point out, which was different, is it also said, make sure you're addressing digital content and making sure that's accessible. And I think that was kind of a new piece.
Wow.
Um, and makes sense. And maybe it's COVID or maybe it's just where we are as a society, but people aren't walking into buildings, right? They're going to websites. They're going for electronic information. They're doing things on mobile phones. So how could we get through the door, like we were talking about before, if we couldn't even find the page or the information in our language? And in response to that, I've seen a lot of agencies, and a lot of these are posted publicly, have revised and redone their language access plans, revised it, updated it to where their programs are, to what persons with LEP are expecting, as far as their experience when they go to these sites or when they go to these agencies. But the other thing, which I think is significant, especially in the last 18 months, is they've been hiring people, staff that are the language access coordinator as their job. And I think that's new. I know that's in other areas, especially in the medical, we've had people that serve as language access coordinators for a while, but in the federal government, it's kind of new. DOJ hired theirs in July 2022. HHS has one now. Health and Human Services has one now. U.S. Department of Labor has one now. And USDA just posted. Actually, I think it's an open position. They're still hiring for that right now as a language access coordinator. And I think that's significant because it shows not only writing the plan, but to what we were talking about, there's a person that will make sure that this is going to happen, that people are taking the steps, the frontline people, that staff are trained, that they know what to do in those interactions. And I think that is significant. And to DOJ, we revised our plan. Our plan came out last August 2022. And if you look at that plan compared to the one prior, you're going to see a lot of differences, a lot more, a lot more clarity on, like I said, electronic content or what should happen in this moment or when should staff be trained. And I think it shows that as people have worked on this topic, they've realized what else needs to be addressed, or what needs to be addressed more fully. And that has definitely progressed over time. I mean, since I started, I think I started on language access in 2005. That progression, it has been significant over that time. And we're at a point now where you don't even have to explain that phrase to a lot of people in federal agencies. They know what you're talking about. They've seen their plan. They know what they should do. I think that's significant. That's something that I've definitely seen change over the last, year and a half, as part of a steady improvement I've seen across the federal government.
Well, it's so
Um,
encouraging to get some good news. And also starting to see that those job titles, language access, director, coordinator, etc., pop up at the state level, which I'm very,
yes.
very happy to see as well, because we stand ready and CIHC to collaborate with anyone to help push the idea that language access matters, that people need to be assessed the same way, right? Not carve out exceptions for doctors or nurses or anyone else. Just give everybody the same test and have them come out the other side labeled as able to provide service in their specialty in that other language if their patients or clients speak that other language. Like, let's just break out of not assessing people and putting them in that position.
It's an unknown. That's the challenge, right? It's an unknown, right? I mean, me self-identifying doesn't help anybody because I don't have any objective measure. I don't have any kind of gauge or scale, right? To
Yeah,
determine,
ancient
you know,
Spanish is not medical
well,
Spanish.
and that's the thing, and the same thing with, the same thing with legal Spanish. In our country, one of the issues that a lot of people are confronted with in federal agencies too is that we only have two categories of interpreters that we can have assessed, right? We have medical, we have two, certifications, and we've got, you know, court interpreters, either at a state certification or at the federal, and that's it, largely, right? There's no kind of uniform agreed upon test for a lot of other different areas where we do need interpreters. And so I think that poses a real challenge too, because like you said, court certified might not mean anything to me based on the setting. That might not help for me very much, in the particular setting. So that is a challenge. I've seen agencies challenged with that. Entities I work with at the state and local level are very challenged with that. So how do you come up with a system to assess competency when there is no certification, right? How do you come up with a system that can help you determine, this person should be, it can serve in this role, which is a very specific and unique skill set, right? That he or she or they are bilingual generally doesn't help me figure out, do they have the skills to serve in the role of interpreter, or a translator? That's very specific. I can't just say generally, they're generally bilingual. I'm like, what does that mean? And I ask this question, when I'm doing an on-site visit, what does that mean? Like, so does he or she do written, non, do they take the English text, or do they do just oral? Like, what are we talking about? They're like, yeah, all of that. That makes me have pause, and that just leads to a lot more questions for me because that suggests that there hasn't been a skills assessment, right? And so those are the kinds of questions, and you'll see in a lot of these newer federal agency plans that kind of delineation. We need to be very specific about the skills we're assessing. We can't just do a general self-identify. What is that non-English language? Okay, now forever we have this person that can. No, that's not how things should be done. Um, and to your point, I've seen states become more specialized in that as well. I think they realize not only the liability of it, but remember that person, if they're a staff person, that is a representation of your agency or your hospital or and so as good of a quality as that is, that's reflecting as much of a commitment as you have to those language communities. And it reflects poorly, right? If the person's not competent and if they're not able to do that communication. So I've seen a lot of entities say, okay, what do we need to do? I know there's not a formal test certification beyond courts and medical. I've seen them work with private language companies or private testing providers to develop a special test for an officer, in a police setting or a correction staff or whatever it is, because they just can't take it on the word of the person. They need something objective that they can say, oh, this person has established their competency. That was not the case 15 years ago, right? I see that more and more in a lot of different areas in a positive way because people are realizing, oh, we don't actually know, right? I have no idea. Like, we need something that we can use so we can understand and that person knows where they are on whatever scale it is. I talk about scale, I'm thinking more like the interagency language roundtable scale. That's what a lot of people,
Right.
refer to, but whatever that scale is. So there's work done on the federal side. I've seen a lot of work done in the last 18 months. On the state side, and you were talking before about kind of individuals and groups and what they've been pushing. I've seen a lot of pushing happening from specific language communities, specific advocacy groups, or groups of individuals have really been pushing and asking, not just at the state level, but also their local government to address language access. And just to give you some examples, not only as far as state laws, but also local laws, county ordinances, executive orders at the county and local level. Now, many of these entities already have to comply with Title VI, but some of them don't. And so I think at the state and local level, it's kind of a way to cover, categories of entities that might not get federal funding, to cover entities that do interact with people who are LEP. And so the most recent example, is just last week. I mean, New Jersey signed a new language access order. New language access law that applies to state agencies. That's a new one. That takes effect immediately. So it took effect last week. In November, Michigan enacted a new language access law as well. And that'll be effective. That one has a little bit of a delay. That'll be effective February 28th, so the end of next month. But they're in addition to, and I think this is what's really important, advocates push those because they're in addition to existing laws. You have laws in Nevada, New York, New Mexico, Minnesota, Hawaii, Maryland, Washington, D.C., California. Collectively, when you think about it, that is significant. That is a significant number. And more am I seeing local groups identifying this is an issue we can address locally at the state level, at the local level, because like we said at the beginning, it's impacting my ability to access providers or services that are critical, for health or for whatever it is. And they are using their advocacy approaches. They're talking to their elected representatives and saying, we need something that protects this. And they're not all laws. I'm not going to pretend that, every single state has a language access law. The progression has been very steep in the last 3 years.
Yes.
I've seen in the last 3 years more state laws, executive orders, and local laws than in the preceding 10. I will tell you, volume-wise. That's what I've definitely seen. I'll give you an example. Massachusetts, they signed a new language access executive order. It's not a law, but it's an executive order, and that just went into effect. But I've also seen communities focus on specific topics too. So not just I want a state law. They've keyed in on specific things. For example, emergency services. So there might have been a flood or a fire or something like that, and the community says, "Look, I had no idea what was happening. I didn't know I had to evacuate my home. I didn't know where the safe place was, and someone was really hurt or someone did pass away or someone could, and we don't have the system. You don't have the systems right now to reach out to me or people in my language community. You need to do better." And I've seen people on specific areas like emergency services or emergency weather alerts really push. I've even seen state attorney generals sending letters to federal agencies saying, we need a national alert system that's available in other languages, which I've not seen that before. Those kinds of pushes for those specific areas, or other areas too, beyond kind of health or public benefits, public participation. I've seen local advocacy groups and grassroots groups reach out to their local government and say, why can't I participate in a city council or a local county council meeting? Why don't we have interpreters there? And I've seen responses of, wow, we weren't doing that. How could we address this? Different than, why should we? And so the response is also different. The approach is different. And I've seen the approaches in places that you would not assume, but people are in different communities for lots of reasons. Maybe they were resettled there. Maybe they have, connection to that community that's there. Why is there such a large Somali population in St. Paul, Minnesota, in that area? But there is. And so that community says, we have needs. What are the ways that you can address those needs? And a lot of work on the local grassroots I've seen. I've also seen a lot of those local communities, language communities, and some of those advocacy groups working collectively, with other state partners, with other partners within their state. There's also development of state and local government entities. You were saying before how there are like language access coordinators, in states at local governments. They have their own network. They have a municipal language access network where they share ideas about how could we do this or how did you do this? And that didn't exist before. Eliana, that 5 years ago, there was no such thing as you
There
know,
was
there was no volume of people with that designated title, and then they weren't kind of sharing ideas. And I've talked to them, I've worked with them, and that's what they're trying to do. What are the most effective ways to do this, to provide notice, to deliver services? And that's different in a positive way. That's something that is really the last 3 to 5 years. That those are recent developments, a lot of those things.
And I have to thank you for sending us the list of legislative changes from federal to state to district, new changes that you shared with me that we will be posting on the NCIHC website. We will be creating a new area specifically for people to get information when they get pushback and they are trying to provide services. They can go and see, well, what federally can I cite? What applies to my state? Is there something that is specific to my city or district that I can also cite that's new that the person I report to is not aware of in order to be able to make the case to provide what is needed? So I think that's a real benefit to our membership, and I thank you for sharing that list.
Well, I think one of the things that advocates realize too when they're doing this work is it is different, right? Just because it's one city government doesn't mean the other city government is exactly the same in how it's
Right.
structured. But the similarities are there, right? Like we have a union too. Well, how did you negotiate the 5% bilingual pay increase with your union? The contract's going to be vastly different, but there's an approach there. You're not starting from zero. And I think that's what I really like about what I'm seeing with the sharing amongst the governments themselves, but also amongst the advocates is, yeah, but at least I have a few examples. Starting from zero, it's really hard. At least they can share a few examples of how do we do a bilingual pay increase in that city? Could we do that here? How did we do the something simple, the language identification poster here? Well, maybe the other city will just give it to you and you can just change your name on. Why do we have to start from scratch all the time?
Why reinvent the wheel over and over again? Yep.
Especially for some of these universal things. Other things are going to have to be tailored, depending on the local law and the state law. And, like, let's use an example like New York. Like, they have a New York State language access law that applies to state agencies. Well, it doesn't apply to county agencies, so maybe they use the model of the state law to create something that applies, so there might be holes you identify. Yeah, so I find that knowing that there are other places like yours, maybe other states or other cities, is helpful. But it's also helpful just to see, I'm not asking everyone to be an attorney and read a bunch of laws, but it's also just helpful to see how does one approach this? How have people approach this? Everyone likes a good go by example because it always is challenging to present something new without a well, and here's four examples from four other cities. That's more helpful than just, well, I think we should do this. So I always encourage people, if you can find a go by or an example for what you want to share, do that. I mean, when I work with entities, that we're doing like a Title VI investigation, with or something like that, I try to find the other example. Like if it's a state court, like if there's another state court that has a really good example of this training, it's going to be different from the court I'm working with, I know, but just so they can watch it and say, oh, that's the kinds of things we should cover, right? That's a lot more helpful than just do a training and cover this. I think you have to do that that work, that homework, to be more effective, especially on advocacy approach. I think it's the most helpful way to do it is know what's already been done, know those examples, and then you say, we're asking for X because that's typically what's done. We're asking for this in a medical setting because every major hospital we looked at has A, B, and C. That's why we should have it here. Your phone tree example is a good one. We reached out to all the hospitals that we could find, that are of the same size as this one, and we asked them how they do phone trees, and we have four examples of how they did it through three different telecom providers, and they were all able to do it. And here's three ways you could do it. That's a lot better than you need to improve your phone tree.
Right.
So like I think that's always a helpful thing to think about. It takes work, um, but and it takes time, especially in this language access work. It
Having
is.
allies now, I think, is the most exciting thing. Allies in more than one area of specialization, because a lot of these workarounds are finding how to get to your target despite the traditional or institutional barriers. I mean, it just saves everybody so much time when someone finds a way to break through, and then you can share that idea rather than trying to still carve that tunnel with that spoon. So that I think has me more excited about what's happening in language access than anything else. The crossover
Yeah,
um,
yeah,
of everyone who is involved. It's not just spoken language interpreters, it's deaf and hard of hearing and tactile and ASL interpreters and facilitators. It's legal, it's healthcare, it's educational interpreting coming up with code of ethics and standards of practice. And I hope we'll see a certification for that specialization. I would love to see social workers who are bilingual have a path to becoming like a test program that they had at Harborview called Community House Calls, where a social worker was also a certified interpreter in order to be able to accompany allied healthcare staff to visit patients at home for palliative care or end of life care and still be able to interpret for the family. These are all things that have been done at least once successfully somewhere. And the fact that we now have colleagues that we can share ideas with, I think is really going to help the changes that we still need to see take place happen. And we need to break out of our silos. It's not just healthcare interpreters, it's all interpreters. It's not just, managers of interpreter services at a hospital. It's who calls the interpreter for the police, who calls the interpreter for the EMTs or the firemen trying to evacuate people that are in a fire zone. Or we've come to realize, and maybe there's only one good thing that came out of the pandemic, which was the courts finally allowing interpreters to work remotely, and many hospitals that had resisted remote interpreting biting the
I
bullet.
agree with that. The remote interpreting is really hard. The pushback that you get, I mean, it's almost no pushback. I mean, prior to like in a 2019 or
It's
2018,
impossible.
there was a lot of resistance. It's
And now
true.
we all live on
I think
Zoom.
COVID, COVID for all of its pain, that it inflicted on so many communities and all of its pain, emotionally on all of us, I think it took away that this is not a possibility, right? It is almost in any setting a possibility. Again, with the right audio quality, I'm with the audio quality, right connection, I'm
Trained, qualified,
yeah,
certified
because
interpreter. Yes.
because one of the things, when I was working in Rochester is a very large deaf hard of hearing community, and
And
a
excellent
lot,
training for interpreters.
right. And the thing is, there are different standards and there's different needs, but there are, like you said, commonalities, right? High quality connection, high quality video, things that should be consistent for if we're committed to an effective communication with a patient or a customer or whoever it is. They should be universal. It shouldn't just be, oh, for this group I need to do this, but I don't need to, it should just be a standard of quality customer service wise versus oh, I don't know that I have a legal requirement, therefore I don't. That's it shouldn't be like kind of calculus, every time. It should just be we're committed to providing full quality, effective communication, or the best quality or most competent interpreters we can, and we're going to do that across the board. That is really the key, getting that commitment. And I'll go to the Title VI piece because this is kind of related to that. I can give a quick overview if that's helpful. Maybe I should do
Yes.
that. So the quick version is people that know me know I could speak at length on this for weeks, but Title VI of the Civil Rights Act of 1964, which everyone calls Title VI, it is from 1964. So if you look at where we are, we're in 2024. It's a long time ago, but this statute prohibits, among other things, national origin discrimination. So if you're an entity that receives federal financial assistance, you can't discriminate based on national origin. Okay, well, how do you connect it to language? Well, also talking about anniversaries, almost 50 years ago to the day, the Supreme Court decided a case called Lau v. Nichols, a unanimous decision, which I know is very rare nowadays, but 9-0. And the court said that when you are, and in that case, it was a school district, going back to our school example here, you need to provide meaningful access to students who are limited English proficient. So why? Because it's national origin discrimination not to provide meaningful access to individuals who are limited English proficient, who are, receiving programs or activities from a federally funded entity. There it was a school, but it could be a state health agency. It could be, the medical center. It could be the nonprofit. Nonprofits are not exempt. You receive federal funds just like a school does or anyone else. And so that's really where the connection was established, between, Title VI says national origin discrimination is prohibited. that decision really helped connect, well, national origin includes discrimination against persons who are limited English proficient. And I know there's a lot of challenges and questions about that phrase and how helpful is that phrase, and can't we come up with a better one? And I totally accept that. But that's the legal one. That's kind of the one I'm stuck with, when we're talking about this topic. And over time, through regulations, and even if you go back to what used to be called the food stamp program, USDA in 1976, 77 started addressing how you need to make sure you understand who the language communities are and start providing services in those languages. Then in the late 70s, a lot of agencies started, requiring the assessment of your language communities. Are you making sure you're delivering services? But it didn't really, for a lot of people, it didn't really it's always been an obligation under Title VI, but a lot of people really mark the executive order, in 2000 as kind of a critical juncture, not because it created new obligations. And I think this is really important. The Executive Order 13166 did not create any new Title VI obligations. It just said you have to federal agencies need to do two things. It's not about entities that receive federal funds. Executive Order 13166 does not create new requirements for recipients. It said federal agencies, if you give federal funds, issue a guidance that explains what are the existing Title VI obligations to entities that receive your funds. And federal agencies, in what you do, so in the programs that you run, your federal programs, and come up with a plan on how you're going to provide meaningful access yourself. So the executive order didn't do anything to the existing Title VI obligations. What it did was it told federal agencies, hey, explain to these entities you provide funding to what it means. U.S. Health and Human Services, write a guidance that explains for the entities you fund, medical providers, and in their settings, in those settings, what it means, what it looks like. It didn't say there's new Title VI obligations. What it said was explain the existing Title VI obligations and what it means in practice. What does it mean I think HHS has a lot of examples in the back, but what does it mean in the hospital? What does it mean in those kinds of situations? The Department of Justice guidance doesn't talk about medical. Makes sense. We talk about what do you do in a correctional setting? What do you do in a court setting, right? But the point of the guidances were not to create new requirements, not to change Title VI or the regulations, but to give a overview of what does it look like practically to provide me. What are the kinds of things you should have in place, like the language access plan, your policies, your procedures. What does competence mean?
Detail.
Yeah,
Yes. You
because
want them to have a language access plan.
it's not required though. This thing, the guidances don't say it's required. They strongly recommend it because why? It's really a lot easier if you have it written down what you're going to do in that moment, or in policies that explain what's going to happen. But I just want to be clear, the executive order didn't create any new Title VI piece. That Title VI piece and its regulations have always been applicable to recipients of federal funds. It just said federal agencies, not every federal agency gives funding, but if you're a federal agency that gives funding, explain to them what it means, for the category of entities you give money to. So the Department of Transportation's guidance, of course, doesn't talk about medical providers. It talks about, highway authorities and things like that. So I think that's an important distinction too. Sometimes people conflate that and say, oh, we're required to do this because of executive order. Executive Order 13166 does not apply to non-federal entities. It only requires things of federal agencies themselves. So like that memo that the Attorney General sent out in November 2022, that's based on the executive order. Agencies themselves have obligations. It doesn't create that order to not create new Title VI. The good thing about it too, it happened in 2000, right? So that executive order has survived 24 years this August. Several administrations of all different kinds. It's never been revoked. And I think that's a positive thing. It shows that, especially at the federal level, it's a longstanding commitment, like I was saying before, to this topic, to addressing this issue. And there's been a lot of enforcement since then. A lot of federal agencies that enforce Title VI and a lot of agencies that do Title VI enforcement have addressed language access in their enforcement. So they do investigations. They do investigations of hospitals or medical providers or state transportation agencies. And when they address a Title VI investigation, sometimes those investigations include language access allegations, right? And so they're addressing the topic when they're doing Title VI enforcement. I'll give you two recent examples from the Department of Justice. Just in the last 6 months, we've done two convenings. One, we did a convening about state courts and language access, and that was done with the Civil Rights Division and with the National Center for State Courts, which does a lot of the court testing that a lot of people know that they do. And that was specifically on state court Title VI obligations, because those are different, right? Those settings are different than other settings. And then another convening we did, which was a webinar as well. These are both webinars. Was law enforcement's language access obligations. What does that mean when you're law enforcement agencies, when you're interacting with the public in specific situations? What should you be doing? And both of those events were very well attended, but they're specific, right? So agencies are not only doing enforcement, but they're doing targeted technical assistance for specific types of entities. And I think that's helpful, right? It's not enough just to say, and I found it in practice, it's not enough just to say the statute's there and read the regulations. That doesn't help you for the day to day, right? When I'm doing an investigation, we have to talk about, for this entity, what does it mean? What would work best for this entity, for this language community? It's not cookie cutter and it's not formulaic. I know a lot of people want it to be, but it's not going to be. It has to match who your community is that you serve and the services you provide, which takes
But the
time.
clarity helps compliance, right? If you help people understand what the expectations is, what is a meaningful language access plan? How can I make it compliant? What are my options? What are the steps that I should walk through? Rather than having them have to invent that mind map on their own, it's going to lead to greater compliance because now I have a path to follow. Unfortunately, still many people in charge of programs don't come from either a life experience or training or study that would give them more insight when they are running these departments. So this kind of clarity, also the clarity that you brought in our conversation today, actually has me feeling more hopeful about the direction that things are going and a little less chicken little, the sky is falling, about the situation overall. So I thank you very much for that. Looking forward, what either excites you the most or gives you the most pause, gives you the most concern?
I think what excites me the most is that trajectory I was talking about, kind of on the federal side, which I think is very positive. Um, I've talked many times, even before I started working in the federal government, of how nice would it be to have a federal Office of Language Access that not only helps federal agencies do it, but provides useful tools for state and local governments to use, or other entities to use, or even just gives them the benefit of a federal contract they could use for interpreter services or translation. That's just a better quality, because people that know me know I'm obsessed with the Australian model of having a national translation interpreter kind of entity that's government, kind of private. Um, and I know I always talk about it, people
Admire
always
that
laugh at me.
too.
Yeah. But that kind of thing is pretty exciting. But absent that, I think what's really apparent is states are taking the initiative, and I think you're going to get to a critical point at some point where so many states are going to have either an order or a law or something. It was probably going to compel some kind of larger action at the federal level. It's probably going to compel some kind of, well, if everyone's already doing it, why don't we just do something that makes it all, mandated and required, which would help in a lot of ways, because one, you wouldn't have to have overlapping laws, like, oh, I have this law here and this law here, and what state am I in? But it would also show the commitment to the demographic realities. I mean, the demographic realities of our country are, you can fight it all you want, but objective census data shows, like, this steady increase of people who, using the census, how the census categorizes people who are considered LEP, is actually, a larger and larger portion, and there's a higher total number too. So that's just the reality. And we don't have an official language in this country, which a lot of people assume we do, but we don't. And so how are we going to address that and ensure we're complying with civil rights laws? So that's exciting. Those are real possibilities. But the other issue, which I think, a lot of people have been addressing, which I think is exciting too, is this artificial intelligence kind of issue and conversation, right? That's happening at the federal level, not just on the language access side, but it is happening amongst interpreters and translators and other language service providers, in the language space. But we've had that conversation for a long time, and I haven't yet seen the study where someone has shown me that the quality output by an automatic or machine translation is equal to or better than that professional human translator. And I would love to see it. I just haven't seen it yet. Even with all these advances, it's still not there yet. And maybe it never will be. But I think people need to make sure before they jump into something like that that they know that they can demonstrate it is of the quality it needs to be. And we strongly recommend not relying solely on those types of automated translations unless they're first verified by a competent translator. If a competent translator or skilled can
Exactly.
verify, that's fine. But that human verification is the piece. It can't just be solely on an automated output, right? And
And it
so
kind of rounds back to the fact that if you had us at the table at the beginning rather than at the end product would be better, which is
it
why
would
I
be,
think it's important for interpreters to not rally negatively against AI, just like my position when video remote interpreting was first being introduced is like, no, it's not going to take your job away from you. It's just that interpreters that can work remotely as well as in person will have more jobs to pick from. So if we would involve translators and interpreters in the process of vetting and checking and listening in and giving feedback where things were right on the money and others went way off track, it improves that translation memory. And we all know the more robust that translation memory is, the better product you get at the end. But it requires that input of
and I
language
want to be really
use.
clear. I have no problem with the use of translation memory.
Yep.
To vetted quality pairs, for certain words and phrases that are used over and over again for a translation will save tons of money for translation process for whoever the provider, whoever needs that translation. I'm talking about, just automatic push a magic button and it
Yeah.
automatically translates.
We're not there yet,
Yeah,
but
I don't.
we
I'm.
should be
I haven't.
working
I'm saying
together.
I haven't seen it
Yeah.
yet. That's the thing. Maybe the study's out there. I just haven't seen it, and I think until we can objectively demonstrate, just like when we test someone's interpreter ability, until we can objectively demonstrate they have the skills necessary to provide the quality output, it's no different, right? To what we were talking about before. We're not
You
in front
cannot
of.
put them in front of a patient,
Right.
right?
Well,
Until
and so
you
that's the
are
thing.
at the point where
Until
you
that
have
point,
that
right?
data. Yeah.
Until the point we have that, like I can't put that person, just like I can't put that device or that automatic system. And so I think that's fair. You just have to prove the quality, and once it's proved, and we have it established, and everyone agrees through a vetted, verified, whatever, double-blind study, then that's different than just, oh look, it's a magic button and it always works, and I don't know what the quality is, but I'm going to use it. That's the part where I'm not going to be on board, for that conversation. Um, those things are important. I also think that there's a lot of international work that's happening. I've seen a lot of more cooperative kind of global language justice, global language access work that I've been
Mhm.
seeing, not just on the North American continent, but you know, again with Australians, but also other Spanish-speaking countries, Central South America. There's a lot more work I've seen with both language service providers and interpreters across different countries working on these issues, and I think that's really exciting and that's new. Maybe that's just the advent of video and just the ease that we can just communicate with each
Right.
other. But I really enjoy seeing that because there's just so many commonalities, both in the issues and the barriers, but also the solutions. Not knowing the solutions will make you feel sometimes that there is no solution. But if you have the opportunity to hear from others of, like we were saying before, wow, that is a way we could do that. I just never heard that before or never had that opportunity. And I know that we're more in a remote phase for conferences, but wherever they are, I'm noticing too that conferences are having a track on whatever it is on language access on these issues, and I find that's really helpful too for professionals, not just interpreters and translators, but also the state or local agency that's attending these conferences, or the legal providers or the judges that are attending these conferences. Like it is a topic that comes up when we're talking about equity or access or ensuring, universal access for whoever the users are. Even on the website, I've noticed the digital content piece it's not where I want it to be. I still think we need really high quality multilingual digital standards like we have for um, you know, you know, other web content for persons with disabilities, but it would be great, this is really, it's moving in a positive way. Um, in a lot of progress has happened over just the last 5 years. A lot more progress at a lot higher pace I've seen, just from what I've seen, than before that time.
And I
Um,
think hitting the fact that improved outcomes, reducing disparities, regardless of whether it's in education or healthcare or judicial arenas or community arenas or involvement in government or voting or anything, it just means that we are in a better place if we're willing to look at those questions and how they apply to those different sectors. So again, thank you for leaving me so buoyed up
well,
from this exchange because, oh, I don't know, maybe the pandemic, spending as much time at home, seeing the political divisiveness really become so entrenched in this country has been a little bit of a downer for me personally. But what we've been talking about has me reinvigorated with, yes, sprouts, seeds are starting to push their heads out of the ground and they're coming up all over the place. And we're looking around and saying, oh, wow, there's somebody who does what I do way over there. And we can connect and we can make change, which is what I'm most excited about looking forward.
I agree with that, and I think, it really comes down to the human level. I think what really matters to people, it's not necessarily where you went to college or what your certification is. It's, can you help me? And when it's that, can you help me? Can you communicate in their language when you're helping them? That's a really basic human thing, and that you're committed to doing that and ensuring that you can communicate and find out how you can help this person. That's very human to me. And I think hopefully that's driving a lot of people more so than, oh, but it's a legal requirement and that's why I'm doing it. Hopefully there's that human piece too, because I think that's really important. We've seen through these tough times, how important it is on a human level, to be there for people and to communicate with people. And hopefully, um, we'll keep some of that, and we'll reaffirm how important that is, with our communications, and hopefully
I
to a
agree
wider audience.
wholeheartedly. Thank you for being here for us today, Michael
Thanks for having me.
Mulé.
Thanks for having me, Eliana. It was a pleasure.
Awesome. I've really enjoyed our conversation. Bye,
Bye.
everybody.